In this Satvic Code Expert series, we have a very special guest today, Dr. Jerald Ibrahim. So he has done is he's a doctor of physical therapy and from the University of Montana, and he's also holding a post graduation degree in treating musculoskeletal disorder, and he's also studied sports medicine. So currently he's working as a head of department of physiotherapy section in a multi-specialty hospital in Dubai. And he has also done certification in plant-based nutrition from University of Cornell. So thank you so much, Dr. Jerald, for giving your time out here and helping us out. And he's also very passionate about Satvic lifestyle and implementing the same in real life as well. And he has helped like hundreds of people with rheumatoid arthritis as well to heal with holistic healing therapies. So please, Jerald, please share your opinion on this, and how do you feel about this plant-based nutrition?
Thank you so much, Seema. First of all, it's been a while I know you, and every now and then
Yes.
I've been talking to you, hearing you
Yes.
speak of the experience of your personal journey, and you also have shared the journey of other clients,
Yes.
your students, and it has always been such a great experience listening to all those stories. And yeah, and today I'm feeling so honored to be in your podcast series. And if I'm not wrong, you told me this is the first one of the expert series, I
Oh,
suppose.
yes.
So I am blessed, and I feel really proud to be part of this. And yes, yeah, especially sharing my experience with you here. It's such a great experience.
Thank you. Thank you so much, Doctor. So in this interview, I'll quickly share all the things that we are going to cover. First, we'll see why there is like rise of rheumatoid arthritis. I would like to have your opinion as well in the same. Then what are the causes of autoimmune disease? Then your experience in treating a patient with rheumatoid arthritis, and what would be the massive action steps that people with RA would like to discuss. So first, we can start with, why do you think like why there is rise of this disease rheumatoid arthritis today? Like people are just following so sedentary lifestyle, they're less active. Because they're less active, hormonal thing is not working, like their digestive juice is not releasing properly, and because of which they are not able to digest they are not able to digest the food they're eating, which is also junk food. So what do you think about the same?
Exactly. What you said is 100% true. The way that I look at it is like, we humans were created by God to be in close harmony with nature, is what I believe.
Yes.
Be it any aspect of our life, be it the food we eat, be it the water we drink, be it the air we breathe, and be it the chemicals that we use, and every single thing that we just come across on a daily basis
Mm-hmm.
should be more in its natural state. And in other words, we have to be closely in contact with nature no matter what we do.
Yes,
And
exactly.
if you take a look at all other creatures in the wild, not the domesticated creatures, when you take a look at all the creatures in the wild, they are
Yes.
always in close contact with nature, just like what I said. And you look into all the religious books, even
Mm-hmm.
you will find that all the religious books tell us that God wants us to be in nature, is what we understand.
Yes.
Probably there may be a little bit of difference here and there, but what we understand is we were originally designed to be in
Yes.
close harmony with nature, is something that we have to understand.
Oh,
So,
yes.
having said that, now take a look at the food we eat.
Mm-hmm.
The present generation does not know what food is. They are eating something in the name of food, but that's not a natural food at all. And
Yes.
presently, in the place where I live, I always see kids just munching KFC and McDonald's
Mm.
and sausages, which are not food at all. And this is what they eat. And now, what do you think? There will definitely be a rise of
Yes.
not just rheumatoid arthritis. Rheumatoid arthritis is one among the many things in the whole list of problems they would end up
Yes.
But if you see lack of exercise, the word exercise by itself is something modern. I would say, like again, if I would just look into these animals in the wild, they don't go to the gym. They don't do
Exactly.
jumping jacks. They don't do burpees and push-ups.
Yes.
All throughout the day, searching for their food and walking kilometers after kilometers would be the exercise. So in
Yes.
our case, again, we have to look into exercise like physically being active. And
Yes.
so physically being active is completely different from exercise.
Exactly.
Exercise simply is a fancy word that's given for, you have a morning routine where you go out for walking, or you go to the gym, do some workouts, and then in the evening you may do some exercise, or you go play some games in the morning, or play some games in the evening, or you take part in a zumba like program, something like that. So
Exercise.
we
Yeah.
believe, I've just received the exercise for my day. Let's say this particular person has burned 500 to 600 calories in a day. And
Mhm.
then, right after the exercise, what he has to do is to go to his office, and he would
Oh,
sit for the
yes.
next 9 to 10 hours.
Oh,
And
yes.
believe me, all the organs of your body, be it the heart, your digestive system, your lungs, your brain, your muscles, your bones, your joints, they're all perfectly designed to be more physically active. All their functions rely on how physically active you are in a given day. Um,
Yes.
so, for example, if I would say there's something called an enzyme called lipoprotein lipase, and this
Yes.
particular enzyme is regulator of cholesterol. So,
Mhm.
for example, if the person is into 100% plant-based food and his cholesterol levels are expected to be in its normal limits, but this person is sitting all throughout the day not being physically active, unfortunately, the release of lipoprotein lipase
Mhm.
relies on how active you are. So
Oh, wow.
30 minutes of inactivity would literally shut down lipoprotein lipase. And so even the normal cholesterol, what is being produced by your liver, will stay elevated without being properly utilized. So
Okay.
there's a chance for you to have elevated cholesterol. So
Mhm.
this is just one among the many examples that I could give as to why you have to be physically active.
Oh,
And
yes.
modern research is linking your depression, anxiety, panic
Yes.
attacks, everything to continuous sitting. So your
Mhm.
joints wear out, your muscles wear out. So it's simple as this: you use it or you will lose it.
Oh,
So we just have to constantly keep it in use by being physically active.
wow.
So look at nutrition, exercise, and sunlight. And when it comes to sunlight, either we have a group of people who do not bother about it at all, or there's a large number of people who rely on supplements, vitamin
Oh,
D supplements.
yes.
But the natural source of vitamin D is sunlight, and we don't
Sunshine.
get it. And what about the fresh air? And we talk more about food, we talk more about exercise, but without food a person can survive for days. Without exercise a person can survive for so many years. But without air, without oxygenation, they will survive for 4 minutes only. Just think of the importance of fresh air. So you just got
Exactly.
to understand, we need to keep ourselves in a place where there's so much of fresh air from nature. And I'm not a qualified person to talk about it, especially because of the place where I live in. All I could see here is
Yeah.
buildings all around, and we don't have trees or anything.
Yeah.
Yes, it's my longing that I will also soon be in a place where I'm surrounded with nature. So, uh, what I'm trying to say here is, because of all these things that we have around us, everything unnatural. And so, when I say in close harmony with nature, day by day, the gap between us and the nature
Is
is
increasing.
increasing and increasing and increasing. And what will increase along with it is the incidence of diseases like rheumatoid arthritis
Yes.
and so many problems. But
Exactly.
rheumatoid arthritis, specifically to say, is closely linked to the food we eat. One of the close contacts we have with nature is in the form of food. And
Food and
yes,
maybe mindset as well. Like
yes,
some,
mindset as well. Yeah,
because our endocrine system and our immune system is also so connected with this thoughts and
exactly.
brain. So like I would
Exactly.
like to say, doctor, like you have touched upon all the important points. Like it was like a bulb on moment for me too. Like when you shared, like it is important to be active throughout the day, not one just 1 hour morning and 1 hour evening may not suffice, right? So
Yeah,
and
exactly.
that is like a very important point today. People think like just 1 hour exercise is enough, but then after that continuously sitting, like you are like taking 2 steps then again walking 1 step behind. And other points about diet that you mentioned, like how processed food industries, especially like KFC and Maggie, since childhood days, continuously advertising industry,
Yeah,
they conditioned our mind for having that
very
processed food
true.
and longing for that type of food
Yeah,
which is not good for us. So like
yeah,
at some point we feel that it was out of control, but now with this knowledge, with this advent of internet, YouTube, we are able to come back to the, at least we are able to get awareness of what is the right thing to do. So even though
exactly.
we are currently living this fast paced lifestyle in cities, we have to do our best to become aligned with the mother nature and follow
Yeah,
the Satvic codes properly,
yeah,
directly given by mother
exactly.
nature. And you
Yeah,
are also in our inner circle, you might be seeing in the community like how people are posting their food habits, their exercise. So just being in that group, forming a separate community of people, we are like motivated and inspired
yeah.
to continue this journey. So
Well, before we move on to the
oh,
next topic or the
oh
next question you would ask me, I just want to
yes,
tell you that
causes.
yeah, a few things about your what you're doing, and I just wanted you to include me in the group, and I just see the activities. I must say that I'm part of so many WhatsApp groups, including my own group, and
Okay.
I must say the involvement by your students and how active that group is and the way you nurture them and keep them
Yes.
active. It is not about just presenting something, I have a solution for you, and leaving them just like that. And
Yes.
the follow up is more important. People fail
Exactly.
when you just give them the solution and leave them like that. But with the Satvic Code, the community that you have formed, I don't see
Yeah.
that. And you constantly handhold them and you're taking through the
Yes.
process in spite of the number of people who join the group, join your program. And you never seem to be tired. And I feel you're being blessed by that. And I think that's such a wonderful thing what you're doing, and I wish to do something like that. I take inspiration from you, I must say.
Thank you so much. I'm like really humbled by all your feedback and really grateful to God that we were able to connect through Satvic Code. And I also saw your videos, your like energy levels, and your message for the universe, like for this everyone living on this planet. You have that strong intention to help people through exercises, and how actively you have posted one video, I think, about exercise, like some
Yeah,
groups. Yeah, like that was so powerful. So I can clearly see your enthusiasm in like spreading this knowledge to the world out there and helping everyone.
thank
So we'll
you.
so we'll quickly come back to the next point, that what what are the causes like of autoimmune disease? Yeah, most of them you have already covered. So apart from that, what could be the other causes like for you autoimmune diseases?
Yeah. Now, specifically when we talk about rheumatoid arthritis, some of you may be aware, some of the viewers may not be aware. Rheumatoid arthritis is part of a family of autoimmune diseases. Now, autoimmune diseases simply mean your immune system, which is supposed to protect you against
Mhm.
infection, or if there is any problem like a cut, an injury, or a fracture, or something like that. For some reason, you developed an inflammation. It is the immune system which comes for help and heals
Oh,
you.
yes.
So basically, they are there to protect you against infection and heal you whenever there's a need for it.
Mhm.
Unfortunately, in the case of autoimmune diseases, what happens is for some reason, your immune system turns against you and it begins to attack those healthy cells in different parts of the body. Sometimes it may affect just the skin,
Mhm.
and we may just end up with diseases like psoriasis or
Psoriasis, yeah.
vitiligo,
Mhm.
or it may attack your brain, which is when we call it multiple sclerosis. It may
Mhm.
attack your digestive system, and you call it ulcerative colitis, and it
Yes.
may attack your joint, and then you call it arthritis. And there are other problems as well, like ankylosing spondylitis, which specifically attacks your spine. So
Yes.
there are like 80 plus different autoimmune diseases
Oh,
out there,
yes. Yes.
which can affect different parts of the body. So
Exactly.
now in the medical world, what we studied and what we tell patients, normally the conventional wisdom is that the cause of autoimmune diseases is idiopathic. What that means is we do not
Yes.
know the cause,
Yeah,
or
it's
there's
new.
no cause at all, is how they look at it. But the truth
Okay.
is, there's no disease that comes without a cause, is something
Okay.
that we have to understand. So, what is that cause then? So, the immune system is put to confusion. There's a chaos over there, and the immune system, out of that confusion, suddenly begins to attack your healthy cells. So I'm just going to take some time to explain this in detail. So
Okay.
it is in the holistic world, in the alternative medicine world. The way they look at autoimmune diseases, it's not, I mean, this idea is being taken by the modern doctors also right now, and people who are dedicated to heal their patients. They look into it, they accept, yes, this is true. That's exactly what I'm going to share with you right now. So in a normal individual, when we eat our food, it goes to the stomach and it gets digested, and
Mhm.
then it goes, whatever is digested, an extract of the digestion goes into the next segment of your digestive system, which
Mhm.
is the small intestine. And at
Yes.
this level, when the food that is digested is in the small intestine, it has to now get absorbed into the bloodstream. Okay.
Mhm.
At this point, the nutrition is being absorbed into the bloodstream. So, at this junction of your intestine and the blood vessels, there's a filter which actually filters what would enter into the blood and what would not enter into the blood. So, this particular place, the filter, is called as intestinal barrier. Okay, intestinal barrier. It's like a
Mhm.
gate where the security opens selected people and he does not permit all of them. And that's exactly how intestinal barrier functions.
Mhm.
So, what would enter into the bloodstream is pure nutrition alone,
Yes.
and nothing else is permitted into the bloodstream. So,
Mhm.
what is not permitted, which passes to the next segment of your digestive system, probably for elimination, would
Mhm.
be undigested food and the waste matter,
Yeah.
and
Fiber.
yeah, fiber, and the microbes, harmful
Mhm.
microbes, which are not supposed to enter in, will all pass through the digestive system, and they are not permitted to enter inside the bloodstream.
Mhm.
But because of the poor eating habits, because of the poor lifestyle people lead, what happens to the intestinal barrier is it begins to break. And when it begins to break, there's leakage in the intestinal barrier. So it's not just the nutrition which will be sent, permitted into the bloodstream now. What happens is all the unwanted stuff, even the
Toxins.
undigested food,
Mhm.
toxins. I mean, food when it is above the small intestine is considered to be normal, but even the undigested, some of the healthiest food, if they find their way into the bloodstream, then it turns out to be a problem. And that's something that is exactly what the intestinal barrier does. So
Yes.
here, when the intestinal barrier is damaged, now all of these unwanted things get leaked into the bloodstream, and which is where the problem is. So sometimes, let's say the when it is about undigested food, you may have some of the carbohydrates fragments entering into the bloodstream. It may be fat particles that enter into the bloodstream. It may be the protein that people eat, which may enter into the
Yeah.
bloodstream, plus the microbes that may enter into the bloodstream. Based on the kind of thing that enters into the bloodstream, one may develop different variety of problem out there. So when some of these things find their way into the bloodstream, what your immune system immediately does is it is constantly patrolling around the bloodstream all throughout the day without any rest to make sure that this place is kept neat and clean. So as it patrols around, when it sees some of these unwanted things over there, it begins to produce antibodies to attack and get rid of that and keep the place neat and clean. So,
Okay.
based on the kind of thing, it may produce a different type of antibodies to attack
Mhm.
each of these unwanted thing which is found there. But in this case, specifically, when protein from animals find their way into the bloodstream, what happens is that your immune system looks at it like, yes,
Got
this
it.
is not supposed to be there, and it
Yeah.
produces a specific antibody to attack that and get rid of it. But
Mhm.
unfortunate thing that happens here is when I say animal based food, it may be milk and milk products,
Yes.
like just milk or yogurt or laban or cheese or butter or even ghee. And these
Mhm.
are all milk products. Okay, that's what I mean by
Yes.
milk products. When something like this, or the chicken or the mutton or the beef or pork, egg, fish,
Mhm.
all of these things are protein. And when any one of these things find their way into the bloodstream, now your body produces antibodies against it. But the unfortunate thing that happens here is once it begins the attack and goes around the body searching for similar kind of things in the body, now it also comes across cells which mimic this animal protein, which is our own healthy cells. And this
Mhm.
process of attacking the healthy cells in the place of the animal based food, this is where the confusion happens. The
Oh
molecular
yes.
structures of
Are
the
similar.
our healthy cells and the animal based food remain the same. They look pretty much the same, and which is when it begins to attack the healthy
Okay.
cells of our body. And this process is in fact called as molecular mimicry.
Mhm.
Okay, so which is where things go wrong, and your immune system is completely confused. So this is where autoimmune. So basically, based on the kind of protein or the kind of thing that comes inside,
Mhm.
different part of the body could get attacked, and you suffer from a specific autoimmune disease. So
Yes.
basically, two things to remember here when it comes to cause of
Mhm.
autoimmune diseases. One is almost everyone who is suffering from an autoimmune disease is expected to have varying degrees of what is called as leaky gut syndrome.
Yes.
Okay. Leaky gut syndrome is a condition where your intestinal barrier is kind of damaged. It may be a mild damage, it may be a severe damage. You may be aware or you may not be aware, but everyone has it. Anyone who is suffering from autoimmune disease will be suffering from what's called as leaky gut syndrome.
Mhm.
And the second thing that you have to understand is the protein is the biggest culprit here. I mean,
Mhm.
in different, there are different doctors who say different things to be the cause of it. But in my experience, when the animal-based protein is
Like casein
completely
and
removed,
lactose. Yeah.
yeah, when it is completely removed from their food, and then comes the change. And
Yes.
so leaky gut syndrome, one is leaky gut syndrome, and the second one is the protein, which I believe are the causes of the autoimmune diseases. And what causes leaky gut syndrome, if I have to specifically talk about it, then there are so many things. The list is big, but of course, a poor choice of food is the number one thing. And of course, then the long-term medications can destroy the mucous membrane of your
Exactly.
intestinal wall. And drinking alcohol and late night eating, and you go to sleep just like that, and you hardly give a chance for your body to digest the food properly, and the food remains there for a very long time. Frequent eating and all of these things, the list is quite huge, and
Yeah,
one may get leaky gut syndrome for variety of these reasons. Basically, we need to
exactly.
respect our digestive system, respect our body, and
Hmm.
do things, and then we can, like, if you're particularly looking for solutions to fix your leaky gut syndrome, then you have to have discipline in your lifestyle, and especially with your food habits, and
Hmm.
then it can help to fix the leaky gut syndrome. I hope that clears the causes
Yes.
of autoimmune diseases.
Yeah, exactly. You have explained this with so much clarity. Like even for me, it was like some new concepts I got to like understand from you. So beautifully you have shared. Like even in our community of inner circle, many people get result just by quitting dairy within like first 2 weeks itself. So
Right.
that, yeah, that itself indicates like how much diet and our the symptoms are related. And
Yes,
because
yes,
of,
yes.
yeah.
This has been something I've been seeing as well. The problem, the only challenge is that people sometimes don't get committed to do it. But if they are committed to do it, like sometimes in matter of 10 days, they see a huge change. Yeah,
Oh, yes. And sometimes because of that leaky gut and their intestinal absorption is not happening properly for due to nutrition absorption is
exactly.
not there. So
Yeah,
many people are also like concerned about weight. They become underweight. So sometimes I feel that this might be the cause for same. Especially
yeah,
people with rheumatoid arthritis are underweight and they think that having more ghee, having more dairy products will help them. But what
yeah.
happens? Inflammation also increases and weight also remains same. Like I was
True.
that I had that problem. Like I was underweight as well, and I would eat so much. Still, I was not able to gain that
Hmm.
weight. So maybe
Right.
our, yeah, intestine is not able to operate and do its
Yeah.
natural function of nutrition absorption, and just toxins is passing in the bloodstream.
Exactly. A lot of these essential nutrients could get washed away,
Yes.
and things that are not supposed to enter in
Mhm.
may just find their way into the bloodstream.
Oh
Yeah,
yes.
as you said, yeah, leaky gut syndrome is supposed to be fixed, even if you want to fix your problem, or even if you want to get back to
Yes.
your healthy weight.
Mhm.
That could be one of the
Yeah, so
important things to
so
do.
all those who are underweight, you have to first focus on healing so that our intestine is again properly working fine. And once you have crossed that healing stage, you can increase your diet later a little bit, exercise enough to build that muscle strength to gain some
Mm,
weight. So
yeah, that's
yeah.
true.
So
Do not hurry up. Yeah.
oh yes. Yes,
Patiently do it. Yeah.
like tortoise. You don't have to be here. So what is like your experience in treating with treating rheumatoid arthritis patient? I'm sure you have come across hundreds of people with rheumatoid
Yeah.
arthritis and the issues of joint pain, musculoskeletal disorder, and all this stuff. So can you share a bit of that?
Well, yeah, I do have a bunch of stories to share, but one of the best stories I will choose and share with you, it was my experience with a Pakistani patient, a female
Okay.
patient who was suffering from rheumatoid arthritis for nearly 25 years.
Oh,
Yes. And as a result of rheumatoid arthritis, her hips developed deformities, and she even went through replacement surgeries for her hip,
okay.
for her elbow as well. And it's only after so many years of doing the surgery, she just came here. I mean, usually patients are referred to the physiotherapist for pain management, like
Yes.
specifically when you look at rheumatoid arthritis, they may have stiffness, they may
Mm-hmm.
have pain, and of course, lack of strength and not being able to walk and things like this. And these are the reasons why a rheumatologist or an orthopedician may refer a rheumatoid arthritis patient to a physiotherapist.
Physiotherapist,
But
yes.
here, I must tell you, just doing pain management and just trying to treat stiffness, has never been fruitful for me, and I've never been happy with what I've been offering. And that's when I started looking at things other than what I normally do for my
Oh,
patients. And
yes.
this patient specifically came to me for pain management and get rid of her stiffness. And I just got to be very careful when I just talk to my patients about a change of lifestyle or things like that. Not everyone takes it well. So I just waited for 2 or 3 days, and she went on saying, my pain remains the same and my stiffness remains the same. I don't see any change.
Oh,
And then I slowly started talking to her about the change of lifestyle, and I just told her about what a plant-based diet can do, something like Satvic Code can do for
oh,
her.
wow.
And she was so skeptical, and it took at least 2 weeks for her. We exchanged our numbers, and we were constantly communicating on calls and on WhatsApp, and we just exchanged a lot of things. And she was asking a lot of doubts. And where will I the common questions? Where will I get my protein from? Where will I get my
Yes,
calcium if I switch over to this
exactly.
food? And things like that. And I managed to convince her at some point. And I told her that there are so many options for you to go into a plant-based diet. I normally just put my patients through a transition diet. Slowly and gradually, you get into a 100% plant-based diet, and then you may just follow that diet until you completely feel well, and that has to be a lifestyle. And then the other one is to include more of healthy raw food in your diet, more of fruits, more of vegetables, more of leafy greens. And I don't know what she understood. At that point, maybe some confusion happened. She went into an extreme form of
Okay.
plant-based diet, which
Okay.
was to be on 30 days of raw food, and 30 days of raw food with very little bit of cheating here and there. And when
Okay.
she goes on a cheat meal, then she would immediately send me a message saying, "Today I happen to eat this." Then I tell her, "Don't worry about it. Switch back and you just carry on with your plant-based food." And 30 days of doing so, in about 1 week time, yeah, approximately a week's time, she just sent me a message that I'm having severe fever, I'm having runny nose, I have sometimes stomach upset. And I was very clear that, she was a hardcore meat eater,
Mm-hmm.
and there's not a single meal that she was eating without meat or without a
Mm-hmm.
non-vegetarian food.
Yes.
So now this was another extreme for her, and I was very sure the body has triggered its healing reaction, which is when you suffer from the runny nose, fever, body
Mm-hmm.
ache, stomach upset, and so much more.
Yeah.
Or in
This
other
can
words,
even
some
be
people,
detoxifying symptom.
yeah, a healing reaction is what we
Yeah.
call as the
Okay.
detox
Okay.
symptoms.
Yeah.
So she was pretty much suffering from this, and I said, "Don't give up, just carry on with it," because she's already into 100% planned, not 100% raw food meal. Then I didn't want her to stop, and she just managed to complete it, 30 days of plant-based food. And then
Awesome.
what we discovered was, she said, "I really have to do something about this. I am seeing something which I've never seen in the past 25 years." But of course, the deformities and everything that develop cannot be changed in the case of rheumatoid arthritis. Only surgery or intense form of physiotherapy can be the ones to get your joints out of deformity. So people have to be aware of that. Just a change in your lifestyle won't get you out of that, but it can prevent further damages. It stops the progression of
Yes.
the problem, rheumatoid arthritis. So she was like jumping and dancing and saying, "I've never seen something like this happen to me in the past 25 years." And then
Wow.
I said, "Well, if you can, please record a video for me. And well, if you want me to come and speak in a meeting, I can do it." And then she went on to, change her husband also. and she brought her husband as well. And it was one of the absolutely great experience I had, because she was especially suffering from 25 years of rheumatoid arthritis. And I must
Okay.
also tell you, and she would, when a person suffers from rheumatoid arthritis, I would expect them to suffer from something else as well, like the leaky gut syndrome. They may suffer from digestive issues, or in the case of females, they may suffer from reproductive issues like
Mhm.
fibroids and
Yes.
so many other problems that
Mhm.
cyst in the ovaries
Yeah,
and problems like
PCOD.
that.
Yeah.
Yes, and she was also having PCOD on both her ovaries,
Mhm.
and for which she was taking treatment for a very long time.
Oh.
And after telling me, I'm just seeing so much of relief after 30 days of being on plant-based food. And in about another 1 week's time, she sends me a message, I have to see you immediately. And I was asking why. I have a surprise to tell you. And I said, okay, fine, come see me. And we met, and she gave me the reports of her ultrasound scan performed by her gynecologist, saying those cysts that she has been having for years also have disappeared. And that was something amazing. So
Yes.
I'm sure now, presently, I'm not in contact with her because she moved back to her country, and then our busy life just stopped us from staying in contact. But
Yeah.
I hope and trust that these benefits that she saw is something that she cannot get from anything else, apart from the change of lifestyle and apart from the change of dietary habits, switching over to something like a Satvic code or plant-based diet. And that's something I wanted to share when you asked me about my experience in treating rheumatoid arthritis patient.
Yeah, this was like a phenomenal story. Like just one solution for all problem. Like these are just
Exactly.
names of different names for the same problem. PCOD, be PCOD or rheumatoid arthritis.
Yeah.
Actually, the
They're all
problem is only one.
diseases.
Yeah,
Yeah.
problem only one related to digestive system, and solution is also one, Satvic code and being aligned with the mother nature. And to
Right.
tell about you, I feel that you are one of the world's unique doctor who has like both physiotherapy experience as well as to heal the patient with plant-based by recommending plant-based diet as well. So this would be like a dream come true if all the doctors in the world will be like you, who can also support this plant-based diet, and soon, like quickly, this world will also become disease-free. So treating
Yeah,
someone with
that's my dream
physiotherapy,
as well. I'm
yeah.
hoping to.
So your unique combination of physiotherapy and diet makes you a unique doctor, and that can be your USP as well. So really happy to connect with someone like you. So we'll quickly now we understood like your case was this case study was like phenomenal. So finally, what would be the recommend action steps by you for the people with rheumatoid arthritis? Like just based on your overall experience, you have such an amazing experience to share. So the your final tips or action step for people who are like still so depressed with this disease. Like they ask me how to be happy. Like when your full body is pain, I usually tell like you have to be happy, active, singing, dancing, like you shared in your previous case study, right? With diet she was also able to elevate her mood, sing, dance, be happy. So this all
Yeah.
is interconnected. So how can the patient with rheumatoid arthritis fall into that loop or happiness and healing, because they get stuck in their own way and they're not able to take that action step ahead.
Yeah. Uh, I think the first and foremost thing is the change in mindset.
Oh yes.
We may come up with any great solution in this world. You and I can talk for hours and hours to patients,
Yes.
telling this food is amazing, this exercise is amazing, this supplement is good, and if you do this, everything can happen. But the change in mindset is the number one thing. I'm just going to share around 8 tips here. There may be other things as well, but to me, I've chosen some of the important things, and I'm sharing here. The first and foremost thing is the moment you sign up for a program like Satvic Code, and then you watch these lectures, you hear a person telling you what are the good things. You don't have to get into this program if you're doubtful. and would it
Yes.
work for me or it won't work for me? And you have to completely believe it, and you just have to have that change of mindset, and I'm going to do it, and
Yes.
I've tried everything else, and this is exactly what's going to help me. And
Exactly.
at times what I get to see is people try to be spoon fed, and
Mm-hmm.
that's not going to work at all. I tell you, that's
Yes.
not going to work at all. And they come back to you, see, I did this and I did not have any solution at all. And just because you're paid, you don't have to expect the solution in 1 or 2 days. You have to be patient. Are you doing everything? The first and foremost thing is to have a change of mindset, and you just have to be committed. You have to be consistent with whatever you're going to do, and the results will come. Some patients may get the relief in 10 days. Some patients, it may take 1 month. There are patients who have worked on it for 6 months as well.
Yes.
I'm coming to that, but the first and foremost thing is mindset. And
Mm-hmm.
of course, then the next important thing is like coming in close harmony with nature, as I mentioned, coming in close harmony with nature. Just look at the different aspects of your lifestyle and see where you're disconnected from nature, and that's
Yes.
very, very important. And in my principle, my community's principle, or my program's principle, is something called New Start. Now, what
Yes.
New Start means is it's an acronym which stands for nutrition, N for nutrition, and E for exercise,
Exercise.
in other words, being physically active, and W for water, adequate amount
Yes.
of water, and avoid all the unhealthy drinks. And then S for sunlight, getting enough sunlight,
Wow.
and T for temperance, which is to have self control in everything in your life,
Mm-hmm.
gadgets, and how you spend your money, and not being stressed, being overcommitted to something. And
Mm-hmm.
this is temperance, having self discipline and self control. When it comes to food, temperance simply means completely refraining or total abstinence from bad things, and moderation in good things. That's what temperance means. And then A
Yes.
stands for air, breathing fresh air. And
Mm-hmm.
R stands for good amount of rest. Yeah, good amount of
Yes.
sleep. And the last T stands for being a trustworthy person for your fellow human beings, and being having trust in God. And that's what T stands for. So New Start. So it's a new journey that you're going to start, and you
Yes.
have to consider all of these elements, which actually brings you closer to nature. And so you just have to see, and apart from this, am I using too much of chemicals in some form? Am I spraying so much on my armpit? Am I applying so much of lip gloss? Am I coloring my hair so much? All of these are definitely going to have
Yes.
some impact, because everything that you apply on your body is just going to find
Yeah.
its
Even
way
that
into the bloodstream.
sunscreen. People like,
Yes,
especially girls.
sunscreen. The
Yeah.
list is huge, actually. And all of these chemicals find their way into the bloodstream with at least a minimal amount, minimal percentage of these chemicals
Yes.
find their way into the bloodstream. So, first is mindset, and second one is coming in close harmony with nature. And the third one, of course, I mentioned nutrition in the previous step, but yes, the third one is wrong food habits have to be addressed. Wrong food habits simply means, I have no doubt it is plant-based diet which can just bring the long-term solution when it comes to getting rid of diseases, not only like rheumatoid arthritis, any disease for that matter. It is plant-based diet which is going. I would rather call it whole food plant-based diet.
Oh,
Uh,
yes.
yeah, it is not a plant-based diet, because I'm so sorry to say that a lot of vegans, in the name of veganism, what they do is like, yes, it is, they have so much compassion towards animals, and they care for the nature, but they don't care for themselves. They eat what's called as a refined processed plant-based food, which is
Mm-hmm.
sometimes worse than animal-based food. So what you eat has to be a whole food plant-based diet.
Oh,
more
yes.
closer to its natural state. Your food
Mhm.
needs to be more closer to its natural state, unrefined, unprocessed form, and which is the next step that I would say. And then the next one that I would suggest is there are from here, whatever I'm just going to share with you are very small, simple things, but we miss out on this. So the next one is frequent eating. Frequent
Mhm.
eating. There
Mhm.
are some medical conditions as to why you may be asked to eat frequently, like pregnant
Yeah.
women who may
Mhm.
not be able to eat 3 or 4 meals, but they can only eat a little bit, or some medical conditions may require you to eat a little bit every now and then. But apart from that, if you think you don't have any of these problems, then you just have to be aware that frequent eating is not a way to go. You see, you have your elbow and it is meant for bending. And what happens when you just keep bending it for the next 1 hour? The elbow would wear out. And you
Yes.
should not treat your digestive system just like that by frequently throwing in something. And
Exactly.
there's a time for eating. Only my suggestion would be eat only when you're hungry. When your stomach is really saying, I am empty, I need food, and that's when you have to eat. And the next one I would suggest is too many varieties in a meal. Too many varieties. Keep your food really simple. How do you
Yes.
respect your digestive system? It's by keeping things simple. You know, if a person has to overwork at his workplace, he will end up with neck or back pain, and his career will soon come to an end. The career of your digestive system will soon come to an end if you don't treat it well. And so, too many varieties, like a lot of us have the habit of eating too many things at a given meal. And
Mhm.
my recommendation would be 2 or 3 different varieties at a time. Would be, even when you make a smoothie, don't try to dump in a lot
Oh,
of
yes.
things believing
Yeah.
that I'm just going to get the nutritious drink ever. Your
Exactly.
digestive system is actually going to struggle. So no too many varieties. Try to keep things simple. And then the next one is bad combination of food. What is a bad combination of food? Sometimes you may have your healthy meal. Along with that, you may have some kind of drinks also. And, especially people think raw food is okay with a cooked food. I wouldn't prefer that way. Raw food has to be raw food, and cooked food should be cooked food. And
Okay.
poor combination of food is the
Mhm.
next important thing that we need to address. And then drinking while eating. Drinking while eating. I mean, this is something common and most of us are aware of it. You should not drink any fluid or even water when you're having food. The reason is your digestive system produces enzymes and acids in
Enzymes.
a
Yeah.
certain concentration. By drinking water, you're diluting it, which hampers your digestive process. So, as a result, your digestive process, which normally may take up to 2 hours to digest, may take up to 4 to 5 hours to digest because you diluted those acids and enzymes. And as a
Mhm.
result of which, sometimes your food may ferment and it may putrefy, resulting in gastritis, gas, burping, heartburn, and so many other problems. And one more thing that I have, the last one that I would like to suggest is avoid late night eating.
Mhm.
Again, this is one way that you would respect your digestive system.
Like especially
So,
after sunset.
yeah, yeah. Again, look at these lot of these animals in the wild. Once the
Yes.
sun sets, and after that, there's no other work, and it
Yes.
is time to rest. And what happens when we approach the end of the day is that almost every single organ of your body. We have this internal body clock called the circadian rhythm or the
Mhm.
biological clock. It rises the hormone levels and the enzyme levels as we wake up from our sleep.
Mhm.
And as we reach the end of the day, they just slow down their entire functions. The
Mhm.
enzymes, the acids that they produce, all just lower down. Be it the insulin, be it the enzymes, everything is very less. So, whereas the mind is working different and your stomach is working different. So, for people who come back from their office, they think like now is the time I have to eat the biggest meal. I want to
Yes.
get rid of my stress and I have to go to sleep. The mind says that, but your digestive system unfortunately produces very less of all of these things. So the earlier we eat the food, the better it is.
Mhm.
And the last meal, especially, the earlier we
Yeah.
eat our last meal, the better it is. At the same time, the last meal of the day should be the smallest meal of your day. So 8 tips that I've shared, and yeah, hopefully that should be of great help to the viewers.
Oh yes, like you have beautifully covered like all the Satvic codes, which are important to help yourself to heal. And I'm like truly honored to have you in this podcast and in this inner circle community. Like the knowledge that you have gathered in years of experience and your education, that itself indicates your passion for this lifestyle medicine. And I also forgot while introduction, you're also a member of American Society of Lifestyle Medicine, right? And like you are like such an inspiration like for all doctors as well in this world who are helping people to heal their disease, and especially the acronym that you shared, new start, which and mainly the first thing, like it is the belief, the faith in this system of healing by mother nature is what will get you started, like faith
Right.
and belief, your mindset. And 80% of diseases is psychosomatic in nature, and the rest is all about aligning yourself with the mother nature. Okay. And Dr. Jerald also has his own YouTube channel. You can learn more about that as well. And I will definitely share his link as well in the description. You can even connect with him. We all are here to help each other to become the best version of ourselves. So the goal of life should not be just healing the disease. The goal of life should be to increase our level of health, becoming the best person, becoming the best version of yourself. And all these are the tools and people and angels like who are helping us in this mission. So when we have this goal, like we have to become the best version and keep that goal in mind, how automatically follows, like when you know what to do, how automatically follows. So even like people sometimes feel that it is very difficult to follow all this Satvic code, and but once you start and once you fall in love with the process, then you forget about the destination. We should always focus on enjoying the journey with this inner circle community. Like that is the reason
Right.
I'm building this community, so that we all can enjoy this together and no one is left alone
Mhm.
on this no one is on this beautiful journey. So thank you so much. It was a pleasure interacting with you, and even I myself learned a lot of new stuff. And I would love to hear everyone's comments who all have watched this video. Just leave your comment and top 3 takeaways from this session, so that we all are relearning the same. Thank you so much, Dr. Jerald, and would like to have you again in some different interview to know more, because there is so much to learn from you. I've realized the same in this interview. So I would like to thank you, and I'm really honored to have you in this community. So I just truly want this world to become disease free. That is my long term vision. And because of doctors like you who are supporting this mission, it becomes even more easier. So you all can check out his YouTube channel as well and connect to us. You can even connect with Dr. Jerald to take this journey forward. So there is uh, uh, always someone to help you when you're really coachable and ready to take that leap of faith towards healing. Okay, so, and yes, do leave your comments below to share your top 3 takeaways, so that we all are inspired by your comments too. So thank you so much. And Dr. Jerald, we would like to have you in next podcast as well, because I felt there is so much more to learn from you. And there is this only when we continuously learn and implement, I feel we get that power to maintain that discipline and commitment to
Right.
stick to the Satvic codes
Yeah.
that is given by Mother Nature. So thank you so much, and see you soon in the next podcast.
Thank you to Seema. It was such a pleasure to be here in your podcast, and I would love to be here again.
Okay, thank you so much. So I'll end the session here.